Okay. There was a question put to me, Heidi, regarding the recordings and how does a commissioner access those recordings?
Commissioners can access the recordings on the Home Care Commission's website or on their Facebook page. So on our website, there is a place for meetings, and you can go in past meetings and find the notes there, and the recordings are on our YouTube page, excuse me,
Okay.
on our YouTube page. So if you go to
Heidi,
YouTube, yeah,
is there a link to the YouTube page from the past meetings?
I can look for that after this, Jenny. Is that okay?
Yes, yeah. I think it would be really helpful to direct people where to find that.
Okay. Duly noted.
Thank you.
Uh-huh.
Heidi,
Yes.
we had an executive session a while back. Can we access that?
No,
Is that the different?
executive sessions are not recorded.
So they're okay. So the one we did with Jane Ellen, that was packed with info, was not recorded.
No,
Oh, okay.
executive sessions are not recorded.
Okay. I did so much talking, I didn't take notes at the same time. I can't chew gum and walk. So, all right.
I do know there will be ongoing discussions about agency with choice, so you're still going to have an opportunity to learn more about it and ask questions.
You can count on me to ask questions about anything.
Okay, Ruth, would you like to officially start this meeting? We can't hear you. I think you're muted.
Right. That wasn't me that got kicked out, right?
I didn't see that anybody got kicked out. I certainly didn't kick out anybody.
Oh, well, I got kicked out completely.
Maybe your internet, but it wasn't me.
It better not be, because I got a whole new system. So
It's not
let's
me.
go. Okay, let's get this meeting going.
Okay.
We don't have any introductions at this time.
We do have somebody named Cecilia. Could you introduce yourself, please, Cecilia? Or she was on, but I think it looks like she also left the meeting or got cut off.
Okay.
So I am watching participants to see if she comes back in.
Okay. Then the adoption of the agenda. I need a motion for the adoption of the agenda.
So moved, Commissioner Mayor.
And Commissioner Adams, myself would second that.
Okay. Any changes or discussion? Okay. All in favor?
Aye.
Any opposed? Review of the January minutes. I need a motion.
So moved, Commissioner Mayor.
I, Commissioner Adams, second that.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, announcements. Are there any announcements?
Chair,
There,
Chair, I needed to let you all know that, I will be working with the next CMS board. And that, I'm working on a thing with them, or will be, to make it more, available to people with physical disabilities in their chairs to be able to see their doctors and dentists more easily, or
Okay,
things into place.
Marcia, did you have something?
yes, I was having trouble getting off mute. I was going back to the minutes. I just had a request that my position as vice chair be noted. Also, Ruth is referred to as Chair McEwen, which she should be, but I'd like mine to be noted also as vice chair. If that's amenable with all you folks. And that's this. I had one. Well, there's going to be a meeting this afternoon after our meeting. So it'll start at, it's a meeting with Disability Rights Oregon, and they're going to be reviewing points on agency with choice as it affects home care as it is, which I think is very vital for us. And so we'll have to have a quick sandwich and jump on their meeting. I don't have, Ruth, can you have that flyer handy? Can you send it to Heidi so she could send out the announcement with the links?
The flyer on what?
Disability Rights Oregon meeting this afternoon.
Oh, okay, yes.
Yeah. If you, it's okay to send it out.
Yes, I'll get it sent out to her before the meeting's over.
Okay, because we don't have too much time. If we send it out later, so.
Yeah,
the sooner the
you
better.
already, Heidi, do you already have that flyer?
No,
Okay,
this is the first I've heard of it, and it's this afternoon at what time?
2 to 4 o'clock,
2 to 4. Okay.
Jenny? Jenny,
Yes, sorry.
will you
Yes.
be able to attend?
I have to look at my schedule. I wasn't aware of it either.
Oh,
You have meetings this afternoon, Jenny.
oh. Well, I wonder if theirs is recorded.
I have one meeting. I could probably go in and out possibly.
Okay, that sounds like you'll get a hamburger. I think if you could do that, that would be good. Because it sounds like it'll have vital information for us. If it wasn't important, they wouldn't be doing it. That's my opinion. So I'm just surprised they didn't get their info routed around better. Okay. Well, I hope as many as can join, because we need to be talking about agency with choice. It is upon us.
okay. While we're presenting on the public testimony, I will go and dig that out for you, Heidi.
Okay. When I'm emailing that, I'll have to stop sharing my screen. while I send this email out, okay?
You can do it like during our break time or any time,
Oh,
something like
okay.
that.
Okay, that's fine. Thank you.
Okay?
Mm-hmm.
So, are there any other announcements from the commissioners?
Mm.
Okay, any announcements from staff? Okay, then let's go to public testimony.
Okay, we do have public testimony submitted by Avery Horton, and I'll read that to you now. Public testimony for February 2024 OHCC meeting. Full disclosure, I am an SEIU Local 503 board member. I am not speaking for the union. Questions in this testimony are not rhetorical and require an answer from the OHCC. Your response to my January 2024 testimony is insufficient. OHCC response. Jenny will respond to Avery's situation. The OHCC response failed to acknowledge and address a systemic problem that is perpetuated by incompetent management. By doing so, you are now part of the problem. This is not an Avery situation. This is a problem that many workers experience due to a lack of caring and/or competence on the part of DHS OHCC, who is ultimately responsible. The proper answer to that question is the name of a person. If someone is not responsible, then that is another problem. Just how deep is this problem? Does it go all the way to Governor Kotek? And it gets worse. He included a email from me. Hi, Avery. Thank you for reaching out. It appears the wrong hourly rate was used when calculating your late pay penalty fees. An underpayment will be processed this week. Late pay penalty fees are capped at the overall gross payment delayed for the first late payment occurrence in the year, the language in place when your payment issue was filed. The wrong rate was used to calculate the penalty fee. The penalty fee should be $127.89, correct gross pay. This was a training issue and has been addressed. Here is my reply. Jenny, this was a training issue and has been addressed. No, Jenny, this is a management and system issue. Errors should be caught before processing, not afterwards. That's a system design error. If someone is in training, their work should be double checked by their supervisor. Failure to do so is a management error because the next person could make this mistake and it wouldn't be caught until someone got shorted. This mistake should not be allowed to happen again. To recap, my original paycheck was short. The penalty check was short. Blaming it on a new person is management failing to accept responsibility. A supervisor or manager must be held accountable. Unless that happens, problems will persist. Unless there are consequences for poor performance, performance will not improve. OHCC needs to respond to the above during the meeting. On page 15 of the January/February 2024 Elevate newsletter, it states how to register, sign up for classes on PACE or email training, the training email. Walk-ins are welcome. I sent an email to training.ohcc@odhs.oregon.gov on January 5th, 2024, and received the following reply. OHCC training 804 to me. Hello, Avery. Workers are responsible for self-registering and self-counseling their own courses. When a worker follows the instructions provided by the OHCC and is then told they are not doing it properly, it is very frustrating. Once again, this shows potential incompetence on the part of DHS/OHCC management. Either management is not making sure staff has the necessary training or is not communicating proper instructions to all staff. Another possibility is staff being lazy and not doing their job properly. In either case, this is a problem that needs to be resolved. Please remember that some workers use their phones and may not see well. It is easier for some workers to register via email than go through PACE. I have heard complaints about PACE from many workers, and I find it difficult to navigate because some things are buried and you have to hunt for them. The quizzes being one example. For the record, I received notification from the OHCC that staff has registered me for the classes. This would not have happened if I had not pressed the issue. Workers shouldn't have to press the issue. OHCC needs to respond to the above during this meeting. From the 2019-21 budget, quote, in coordination with the Oregon Home Care Commission and SEIU, implement a new model for managing the home care worker program that lessens the workload of APD staff working in the CEP program, unquote. Please explain exactly what the new model is and what exactly when exactly it was implemented. Please list the names and titles of the OHCC, DHS, and SEI people who worked on and implemented this new model. From the 2023-25 budget, quote B, in-home agency services. Many clients prefer to receive their in-home services through an in-home care agency, unquote. How do we know this is a fact rather than opinion? Exactly how many clients prefer to receive their in-home services through an in-home care agency? How was this number determined? Were clients polled about their preferences? Were clients persuaded or nudged to use in-home care agencies by case managers? OHCC needs to respond to the above during the meeting. Time is of the essence. Now that the OHCC and DHS has been made aware of their shortcomings and failures in a public meeting, they cannot take the position they did not know. Testimony respectfully submitted by Avery T. Horton Jr., home care worker, citizen, voter, taxpayer, state of Oregon, as always, acting in individual capacity, and a testimony. So I'd like to start by saying that the commission staff does this work because they care about people, both the people who receive services and the people who provide those services. And to err is human, and the goal is to learn and grow from our mistakes. And as the executive director, I am ultimately responsible, and I do not take that responsibility lightly. However, I do recognize we all need support and guidance. So with respect to the issues that Mr. Horton identified, staff has received additional instruction and training. Mr. Horton shared an excerpt from the 2019-2021 legislatively adopted budget DHS audit response report on page 23. And I'm not able to fully answer Mr. Horton's questions as the commission didn't prepare this report, and I'm not aware of the broad stakeholder meetings. Since this time, however, there has been community partner involvement with the development of the workforce development strategic plan and also the training standards that were implemented. Mr. Horton also shared excerpts from the 2023-2025 legislatively adopted budget and Aging and People with Disabilities program narrative, pages 10 and 11. I'm unable to answer Mr. Horton's questions as OHCC did not prepare this report. And regarding the word choice of many, we do recognize that it is broad, but we also know that there are individuals who prefer to use an in-home agency. Individuals choose whether they receive services from a home care worker or from an in-home care agency. And that is my response to Mr. Avery's testimony, Mr. Avery Horton's testimony.
Any comments or questions from the commissioners?
Yes, this is Commissioner Adams. With all this being said, Jenny, I know that you do your best to your ability and have a lot on your plate. So I want you to know that as Commissioner Adams, I support you.
Oh, well, thank you so much.
Yeah, this is Commissioner Johnson. I appreciate, Jenny, your comments and the work you do, and I appreciate that Mr. Horton is able to share his concerns as well. And I would hope that he would understand that that we're doing the best we can with systems that do need to be improved in some ways, and helping us identify or is certainly beneficial. I just hope that he would maintain a professional attitude as well in that process so that we could work together on these issues.
Much for that comment.
Any other commissioners? Okay, I have just been notified that James is here. So I'm going to go ahead and put him on and to conserve his time. So James, you want to go ahead and introduce yourself and what your title is and what you're going to be sharing?
Yeah, if it's okay, I'll go ahead and share my screen as well.
Yes.
Yeah, but my name is James Barta. I am the Engagement Strategies Manager with the Oregon Eligibility Partnership within ODHS. We're the ones who manage the one system, and which, I know is a source of some anxiety and consternation. Certainly, I find that in my work, but it's good to be with you all again. I think I was here last fall speaking about the one system, and it's good to see some familiar faces as well. So I guess I'll just go ahead and jump into it. I should warn you right now that this agenda or this presentation is a little different than the one you received yesterday. We did some adjustments to it. I think we added one slide and changed the order a little bit. So, but 95% of what you got is the same thing that I'm presenting here. So I can get this updated version to the committee administrators, and so you have this version as well. So, and before well, as you can see, this is what I'm going to be talking about. Like I said, the order is a little different, but please feel free to jump in the chat or come off mute if you have any questions. There will be some time at the end too for a discussion, I hope. I got to get through a bunch of slides here. But as you can see, I'm going to start off talking about the medical renewals and give a status update of where we're at. Just briefly touch on the Oregon One mobile app. Talk about how we're doing our community outreach, and then get to the call wait times and what's been going on with all that. So let's start talking about the medical renewals. Now, hopefully this slide is a little familiar. It's a reminder of how we've been going through the renewal process. We're now in phase 3. Let's see, I'm going to be going into more details about how this process is working in the subsequent slides, but this is some of the considerations that we had taken. We heard from the work group and tried to front load some of the easier ones, and so now we're spread throughout some of the long-term care cases and such as we're really into the thick of it. But do think of this as sort of the back end of this process, because 83% of the renewals have been completed. And January is our final month for this initial 10-month plan. So we have not started renewals for over 100,000 people. Now, a lot of these are because of previously discussed issues around, particularly around OSPM. There was a federal request to review the automatic renewal process for the Oregon Supplemental Income Program Medical, OSPM. And so we're seeking federal approval on an amended timeline for this group. We'll hopefully May we'll have an update on this automated renewal process, but we still have to get federal approval. So our proposal is to stagger these 110,000 or so people over 4 months. And so they would follow the same process as before, where they have 90 days to respond and 60 days advance notice before any termination of benefits. So this means that this whole redetermination process, the final responses would be due December of this year, and the final closures would happen in February 2025. So once we get federal approval or whatever it is, we'll let you know. But I should note that if you're familiar with the dashboard, and I'm going to talk about it a little more later, these renewals do not appear yet on the medical redetermination dashboard. Okay, so plugging right along, here's a little more data of how these outcomes are, how our renewals are going, and it's good. You know, almost 84% have been renewed, and of that 83.8%, the vast majority, 84.7, continued with the same benefits. Some had a reduction, and then of course some benefits ended. Now this next slide, while it looks very similar to the previous slide, is actually pretty different, because this one is talking about, well, previously we talked about outcomes. This slide talks about what people had to do. So we have gotten to 93% of the renewals, and 2/3 were renewed without any action on their part. It's top in the nation. Some people were, you know, just had some information, and 7.5% had to go through a full renewal, you know, a full, basically an application process to renew. Commissioner Adams, do you have a question?
No.
Okay. And you know, some of the requests for proof, such as government ID or pay stubs, you know, those are often those are typically the actions that are needed. Yeah, so to dig into a comparison a little bit, we are second in the nation. We're darn close to meeting Maine, but we're right behind them in terms of the percentage of people renewed. So I like to say we're practically number one, but we're still trying harder. So we are doing relatively well. And then I like to point out too that when it comes to ex parte, or basically paperless renewal, we are tops. So trying to make it easier for everyone. You know, there's 79%, like I said before, that can renew without having to do anything, because we're pulling that information from Social Security, or if they have SNAP, we have that information. So so it makes it quite a bit easier. So, of course, even in the successes, there are some populations that we're not hearing from as much. And so I'm going to be talking about a little later on some of our outreach efforts, but I just want to point out these second and third sub-bullets here. Two of the populations that we're not hearing from as much are people over 65 and people on long-term services and supports. So one of the things I would love to hear is people in places that we should be reaching out to help encourage any of these populations to make sure to get their information back in. We need their address. We need, you know, if there's a request for information, they need to respond, things like that. So this is what our data is showing us so far, that it's these populations, particularly, you know, people over 65 and those in long-term service supports, are not responding at the same rates that other populations are. So this is where I talk about the mobile app. Yes, Paul.
I'm curious to know regarding the differences in responses. Is there a difference in outreach efforts? Could that be contributed to the approach that's being used? I would in outreach to these folks for the different populations.
Yeah, we've identified these populations only in the last couple months, and so we are actually trying to increase our outreach in these areas. But it's yeah, and I'll be able to talk about some of the specific outreach techniques that we're using a little later in more detail. But it's something that we're aware of, and I mean, I'm hoping It's not because we're doing, I really don't believe it's because we're doing less outreach to these groups. It's just for whatever reason, they're harder to reach. Maybe they move more often, or they simply just, our techniques that we like to use, they don't trust. They don't like, like I was about to talk about the mobile app. Over 65 people are going to be using the mobile app less than other groups, for instance. So, I would love for people here to give, whether broad or specific suggestions on who we should be talking to. How do we encourage the trust that, people make that phone call to the customer service center and see what's going to be going on with their benefits, even if they still have them. They shouldn't wait until they're gone before they make that call. But yeah, different reasons for different groups. Yes, Marcia.
Yes, hi there. I'll address people over 65. Very often in that group, you might have a surviving spouse, and the spouse that's deceased was the paperwork driver and the organizer, and the remaining spouse, it's not in their wheelhouse, and they might have tried to catch up on it and failed. It's possible that they don't have an organized system for filing all their papers, and don't really know where they are or how to get them. I know home care workers in home are not supposed to help you with your paperwork, but I think there comes a time when that needs to be looked at. If a person loses their benefits because they are not skilled at keeping the file drawer organized, or don't know how to get on a computer their latest Social Security update benefit letter, that's very biased against them. They need to be helped to succeed. It's not just to win a contest. Losing your medical benefits means, in many cases, losing your life. Somebody needs to step in there. It could be their home care worker, and I don't see it as the home care worker having a chance to misrepresent their information or doing something nefarious. If they could just help them retrieve the letters, they don't even have to fill out a form. If there was an option that they could just send like a fax in or dump them as a whole with one office, and let them take the documents and put them in the form, and then send it back, and the person could sign it with a regular pen and not have to learn how to do DocuSign or some other thing. I remember a story of my dad in his growing up in rural Canada. He was playing in the field with his younger brother. They were like 4 and 5 years old. And this thing came across the sky, and they didn't know what it was. They hid behind a rock wall and managed to go from rock wall back to the home, and were consoled in the arms of their mother, who also didn't know what they saw. turned out to be that a young man from a city near a city actually landed on the beach in his small airplane to see his girlfriend. But the whole community did not know what this was. They didn't have radio, they didn't have television. And sometimes I feel like this myself now. When I sit in front of my computer, I think of my dad. There needs to be another way to reach out because they might be afraid of the airplane, they know not.
Yeah, that's a good analogy. Yeah, there's so much new things that we're throwing at people who, were around before computers,
Yeah, I've been very blessed in my educational level, but a lot of it happened before there was a PC.
Yep.
And I look at this thing and go, what on earth? There has to be a way to take care of people that haven't seen an airplane.
Yeah, I think it is part of that human touch, and I think that gives me a good frame for me to talk to the aging people with disability workers, the home care workers, to see what we can encourage them to do. As you point out, that I'm sure they are not trained or paid for doing personal paperwork and such, but there's got to be some things that they can do to assist, and I'm sure some do, despite that being outside their job description. But no, that's a good frame for me to ask the question, so I appreciate that.
Welcome.
And I will.
James, this is Commissioner Adams. You know me as well, being on the co-chair of the committee that you're at. The thing that I had come up with is Nikisha, the director of Oregon Health and Human Service. She has two types of branches that splits down the middle here in the state of Oregon. She's got one that is the disabled people, and then she's got the other branches, which is nothing but people over 65. So I would like to suggest maybe you could get with Nikisha and find out where her branches are that have case managers dealing with people over 65. Like there's one down here in Medford that is, she's got one branch down here, which is one with disability and another one with seniors over 65 with case managers. And maybe you might get a response out of case managers reaching out to their 65 and over population. And her branch down. I'm not quite sure where her other branches are that are over 65, but I know this one down here. Pretty sure they're all over the place. If you talk about it.
I could reach out to Nikisha or those who are responsible, more directly responsible over them. But yeah. All right. Well, I'm going to move forward. And is more of just a little reminder about the One Mobile app. But I do want to emphasize that there's not this obligation to use it. This is another option. And it's available in English and Spanish. And the thing is, most of the work, the documents that you need to submit, things like that can be done through the app. So I think it's in anyone who is interested or comfortable with working through apps, I would really encourage you to check it out, I guess. But of course, you can still call, you can still go to an office. Those options are still available as well. And, there's a little video for it, and I'm just going to, it's only like 2 minutes long, but in the interest of time, I'm going to Shoot, I thought I could, I'm just gonna drop the link for it in the chat. So I can't. So
Well, it will also be on the information that you're going to send to Heidi to send out to us,
yeah,
won't it?
that's true. That's true too. All right. So
And I have a question on this.
yeah,
Is this set up to take up the new system that they're looking at for home care? Is it doing anything with the agency with choice?
I do not know the answer to that. The system for home care choice.
Yes.
Okay, I will have to get back to you about that.
Its correct name is Agency with Choice.
Agency with choice. Thank you.
We want to make sure that if we're setting this up, that it's going to be compatible with that too.
Agency with choice in the app. Okay. So let me, we were sort of alluding to this earlier about how we're doing the outreach. And really there's sort of three buckets. There's the direct personal outreach, there's the indirect, and then us working with partners. And I'll just run through each of them here. But the direct outreach, as you can see, is case managers calling people and helping them understand the options. There's marketplace for those on the marketplace staff. They're calling, and then of course there's all those notices, renewal package, just reminder notices via text messages, whatever. So that would, it's pretty straightforward. Someone is actually personally contacting you, but it could be, something in the mail, it could be an email, but it hopefully is also a person actually talking through. And the next one, though, is a little more subtle, but there's a national campaign, the Don't Wait update, done by the federal government. But we have, and hopefully you've seen this, the Oregon Keep Covered campaign. And we have paid ads in 14 languages on social media, on the sides of buses, bus stops. There's been billboards. Hopefully you've all seen them somewhere around. And there's been print and radio ads as well. So, and this is where we're wanting to make sure, how do we reach people where they are, especially in those groups that I mentioned earlier that are not responding at this higher rate. We did also have paid campaign advisors representing 19 priority populations. So there was a few different things. We're working with a consulting group to help buy the ads and help target these populations. And finally, partner outreach, working with medical assisters, with the CCOs, the fee-for-service providers, as you can see, using one notice guides, and as I mentioned, these some of the partner organizations were paid as the service ambassadors as well. So just to give a sense of some of the efforts that are going on, and if you want to learn more, you can also come to a webinar, and those, as you can see the dates there, and then in addition, there's also these office hours where they're designed for partners, but I think it'd be of interest for this group, and as well informed as it is, would be great to have you as well. We're in a partnership with Oregon Primary Care Association to co-host these office hours, and I'm working on those. And well, you'll get this information as well here. The links are in the chat too. All right. Now, a lot of text here, but we're now getting this non-response data, and people who've received the renewal packets have not responded after 30 days will receive a reminder by mail. And we're getting these reports and letting the CCOs know who they should be contacting. And it's, they're tracking unanswered calls, and we'll call back at different times. It's a lot of people to reach, but you can see some of the efforts that are being done. And finally, in this part, there's the Keep Covered campaign itself, where if you know of an event that you're going to be at, we can get materials, printed materials to you for it. We can even customize it. They're available in many different languages. So these resources are all available. I would love if you want to avail yourself to these. So
question on that.
How
much? Yeah. Hi, this is Roberta. How much lead time do you need if we would like to get materials from you? Is it readily available, or should we order up?
That's a really good question. In my experience, the turnaround time has been pretty fast, but of course, they got to mail it to you too, and so that takes a little bit of time.
So maybe a month out or something.
Well, I was going to say, 2 weeks is
okay.
Would be good.
Okay, great. Thank you.
But a month would be better.
Okay, sounds good. Thank you.
Yeah, thank you so much. All right, so okay, as a broader view here, customer service is obviously a priority for us here at ODHS, and wait times were ridiculously high. We did go through what we were calling a sprint, and pulling people out of training and pulling people out of other meetings just so they can work the phone lines. And so it was, and I should mention too, at the same time, this is internal stuff, but we were putting in a new phone system that people have to get used to. Oh, and Ruth, I see your hand is up.
Well, I just have a question. That the problem with your system is that if a case manager doesn't turn in a change of address, then all the one information goes to the wrong address.
Yep.
How are we going to get past those weaknesses?
Well, if someone is not inputting the data, it's not going to work. I'm not sure what to say other than, gosh darn it, those case managers better get those change of addresses in. Just like when people move on their own, often they a lot of times don't let us know, and we're sending it to an address they're not getting. And so employees and program benefit recipients, we all have to keep updating things. It is definitely a joint effort, and and that could be part of my communication with the caseworkers too, is to emphasize the importance of that. Paul?
Because that person lost three months of their food stamps and several other issues, and then the case manager says there isn't anything they can do about it. So we've got to stop those leaks.
I wonder about that. I think they would have a case, especially if it was the case manager who didn't send in the address. They could appeal that. for SNAP benefits, they'd have a case. I'm no expert in the appeals process and the thinking behind it, but from the sounds of it, they can submit for an appeal.
Okay.
Paul?
Yeah, and James, you may have already mentioned this if I didn't capture it, or maybe it's just a different topic. I know that you guys are doing outreach to the case managers or local offices, as we've been talking about. I wonder if it's been sufficient, or maybe so that they, understand their responsibilities with in reporting changes like as we just discussed, that type of thing. I do know that case managers, at least for APD, are often, well, a lot of them are new. There's been a turnover, and many have just really heavy caseloads and so forth. And so it's hard for them sometimes, I think, to always maybe follow through, possibly in some areas of their work, especially if it's something not right in front of them. I don't know. But I just, when we were talking about the populations that maybe are not responding in an earlier slide, and then this issue of case management, I just, I'm not doubting that the communication has been made. I just wonder if it's been sufficient maybe to keep it in front of case managers, or maybe better yet, their office supervisors as well, who can be working with them in their unit, in their local office huddles or other meetings, to be reminding them of these responsibilities, so that they're not overlooked.
Yeah, I appreciate that.
Oh,
Go
sorry.
Yeah,
Sorry,
go ahead.
Paul. I didn't mean to interrupt you, Paul.
No, go ahead, Marcia.
Oh, okay. You know how Sheba helps people make their insurance, gives insurance advice. They're trained and they're vetted. Maybe we could have our own little dead letter office with some quote unquote detectives that are vetted and trained and could handle material. We know that they're not going to be selling addresses and whatnot. But to solve these, where did they go? Case manager doesn't have time to do that. Help find out where they are and that they have truly moved or just are incompetent of reading and understanding their letters or getting their letters out of the mailbox. Whatever. Have our little own drama, TV drama going.
Yeah. I suspect there are people on this call right now who know more about, well, I think everyone on this call knows more about the process of, caseworkers interacting with the program recipients. Everyone here knows more than I do, and Paul, I really appreciate your comment that they do have heavy caseloads and it's work. And Marcia, that is an interesting point. I want to find out, is there a team of investigators or whatever that at least, snoop to see if, why is this person no longer responding, but during this renewal process, of course, we've got, we had a 1.5 million people where we had to figure out what was going on with them. And it's a lot. We're going to have 110,000 coming up in this HOPE-SIPM portion, and so if anyone wants to from the agency side speak to this, I'd be happy to hear it right now. But otherwise, I will go ahead and snoop and see what I can learn. This would be helpful for me in any case, and I'll get the information back to you.
I like your choice of Snoop. Yes. All right. Okay. Well, fine. Peter Falk of Colombo.
James,
James?
James,
Yeah, this is Paul Johnson again. I know you have a lot of work to do on this. I was thinking, and I'm not an authority on this, but there's some communication channels that maybe need to be explored if they haven't. And again, I'm ignorant about that, so I admit. But there's a regular monthly meeting with district managers and program managers that is held in APD. There's a community training meeting with case managers as well. And I don't know if those would be good venues, possibly for you or one of your staff to communicate some of these things for those local offices. It just might be, again, maybe that's been done, but I figured I would suggest it because it sounds to me like one of the challenges that you face, and it's a big challenge, I realize, among many, is just communication. And so those venues may be helpful for you. And so I would recommend contacting Jane Ellen Wydance or Matt Raposa, my manager with the Medicaid Services and Supports Unit, for more information about how to be part of the DMPM meeting or the community meeting for case managers.
Yeah, I'll admit, I come from SSP, so I know that group more. I'm still learning the APD. I know Jane Ellen, and so I could easily reach out to her. So, George, you were going to say something?
yeah, James, I know that on this committee with Ruth being on our committee also, I know that you've been wanting to get people to bring up the subjects that need to be done in this. I think this would be the time, if you want to bring it up, to get people to start bringing in, if Ruth will allow it, to tell what needs to be done as far as what they want, so we can work on it in this committee.
Oh, I see. Yeah, I didn't prepare a slide on that, but I'll just mention that, and I'll have to dig up the link, or I'll email it to Heidi. But what George is referring to is a committee that Ruth, and I think someone else is here for it. But we have a one online improvement committee, and if there are specific suggestions you have about the one portal, we have a forum for you to make those suggestions, and the committee will consider it. So I'll make sure to get that link to you, and so slowly and surely we're making small improvements, and we're going to start looking at some bigger ones too, about just making that one portal a little more understandable, a little more accessible. But keep in mind, we are under a lot of both technical and limitations and federal regulations that we have to keep. Certain things, like everyone hates the fact you have to change the password every 90 days, for instance, but the feds told us, what, you're doing 90 days? Most people do it 60 days. You better, don't think about it. And so, we get stuck with frustrating things like that. But in any case, yes, thank you for calling that out.
I would also recommend that if you get somebody that has some changes, that you explain to them how changes are made and the long process that it takes to get a change made. Because people are going to offer these things and expect to see something happen. And with the system the way it is, it's not going to happen for a long time.
Yeah, even a small wording change, say in a question, that'll take us, we got to put it in front of the committee, consider it, write it, and then that'll take a month or two at least, and then the actual put it through the system, that'll take a couple more months. So it's a process.
A question about the future.
Yes.
Is the goal of one system, I'm taking it literally, as to do your updates, renewals once a year and it be over with. I'm facing it every couple months. I just got the medical renewal done and I've got now less than 2.5 months before I have to do food stamps. And then it'll be another 2 or 3 months and I gotta do something else. And then I gotta do food
Yeah.
stamps over. One system is not one.
Well, it is one system with many parts. And so
Aw,
unfortunately,
I wanna be literal.
I know. It's it's something that we're looking at. It makes sense to align, if you're in SNAP and have a medical program or 3, it makes sense to align them. But like we're moving to like OSP, which would allow renewals every 2 years. But SNAP, by federal mandate, it's got to be every year. And then there's a 6-month check-in. So there's always going to be this, even if you do align it, you're still going to have different programs requiring different things.
But if you could draw most of the information from what they have,
Yep.
it would simplify what people have to give them and perhaps increase their success rate.
Yeah.
I'm an optimist.
Well, and I mean, the reason we had so many people able to renew automatically in OHP is because we were able to draw upon other sources of information. I think SNAP was a big source of income information. So 2/3 of the people going through medical determination didn't have to do anything because we already had their income information. So it started, it's just, I suspect it's always going to be frustratingly behind where we think it should be. But and that's not to say that you shouldn't complain and shouldn't push, because we need you to do that. That's your job in this process, is not give up on it, is to keep pushing us to be better. As a former advocate, I like to remind people that, I'll give plenty of excuses why we can't do something, but don't stop pushing.
Okay, that's encouraging. Don't take my dog seriously.
Thank you, James, for this presentation, and thank you for being open to our questions. We appreciate that.
Yeah, absolutely.
It's been great. Thank you.
Yeah.
And we will expect you to come back and keep us posted.
It would be my pleasure.
So our next presenter is here. Brian, are you ready?
I am ready.
Okay.
And whoever it was that made the Peter Falk comment, I truly appreciate that. It brings back memories of watching a good old investigator solve mysteries in a trench coat. So thank you all very much for that.
That's Marsha Wenzel. Hi, Brian.
Once again, I want to express my gratitude for you allowing me to be a part of this this presentation and to share this with you. As a part of, for the record, my name is Brian Holman. I am the Budget and Fiscal Analyst for Aging and People with Disabilities. And part of my responsibilities up until recently included the Home Care Commission budget. As part of our growing state staff and whatnot, it was determined that we needed some additional help. And part of that help is taking over the Home Care Commission budget report. And so we have hired, as of January 8th, a new analyst named Cola Bickford. Comes from us from the private sector, but he has already shown an incredible aptitude for reporting and analysis. And I'm going to give him a brief moment to introduce himself, and then I'll take over with the budget report.
Good afternoon, all. I'm Cola. He, him, or they, them pronouns are both fine. As Brian mentioned, I came from the private sector, worked for credit unions for the past few years doing financial analysis. So this is my first foray into government work, and very much looking forward to working with y'all. Budgeting and data is my happy place, so looking forward to filling that niche for y'all.
All right, thank you so much, Cola. Yeah, it was great. We were recruiting for one analyst, and our recruitment pool was so great that we actually were able to fill both of our vacant analyst positions, and we are really happy to have Cola Bickford as part of our team. Our budget report, we are now at 1/4 through the 23-25 biennium, 6 months complete as of December 31st, 2023. Our budget numbers have not changed since the beginning of the biennium. We're still just under $8 million of general fund and other fund budget, and $2.3 million of federal fund budget for the Home Care Commission. What this does not include is this does not include any salary pot increases. We should know those numbers by the end of February, and those will be reflected on our next budget presentation, which should be in May. Total budget available is $10.2 million. To date, we have spent $1.47 million of general fund, which is 18.5% of our allotted general fund dollars. We are currently projecting a deficit of just under $10,000. But again, this is without those cost of living adjustments that we should see. And we could see this be anywhere in the neighborhood between 6 and 10% of what our current general fund, other fund budget would be. So that would increase that between $400,000 and $540,000 additional resources. So we've got plenty of room to work with here. This also reflects the bonus. This was paid out, a $1,500 bonus that was paid to eligible employees back in August. That's also something that will be included in that cost of living adjustment that we'll see through the salary pot. One other driver for this month that we saw, we had an individual that works with the Home Care Commission that was on a temporary assignment for humanitarian aid, and that individual's payroll was corrected, which caused a reduction from our estimates by about $48,000. And so we increased our savings there, or we reduced our projected deficit there, and that'll be apparent when we're showing you the graphs. To date, for our administrative budget, we've spent $1.3 million. Not a lot in the federal fund on the admin side, but that's anticipated and expected. Heidi, if you'll scroll down to the next page. Here you can see the breakdown on a month-to-month basis. We've been projecting about $205,000 per month in our administrative budget. And you can see that the actuals for this month are about $50,000 less than that. That is because of that individual. I see Commissioner Adams has a question. Yes, sir.
Yes, you were stating that there was a $10,000 deficit or something like that?
Yes, we are projecting, and the deficit is projecting that all of our services and supplies dollars get exhausted through the end of the biennium. That allows our administrative staff to dedicate those funds accordingly. The payroll numbers where we're showing a deficit are because of that $1,500 bonus, and that's pretty much the only driver for our deficit, which will be erased with our salary pot.
Okay, so can that be regained where it won't become a deficit, or is that impossible?
Well, because we don't know what the salary pot is, we're dependent on the legislature and our Department of Administrative Services to allocate those. We have to assume the worst when we're reporting. So when the monies come in, it would immediately flip that deficit to a savings, and I would anticipate the savings to be in the neighborhood of $400,000 once that arrives. I just am not allowed to present that until we actually have the numbers.
But actually, the money has to come from the legislator.
Correct.
So, okay.
So are there any, oh, yes, do you have another question, sir? Nope, we're good.
Yep.
All right. Continuing down, you can see our Home Care Commission training. We are increasing the expenditures there. We jumped up to just under 100 or just over $100,000. This is an area where we do get that federal match. We're getting about 30 cents on the dollar match for our general fund investments. We should see an uptick in our Home Care Commission training over the next several months and for the rest of the biennium. We've got a lot of resources here available, and I know that Jenny and the Home Care Commission administrative staff is working on that. For the Employer Resource Connection, one item that I was pointing out was that the invoices for Home Care or Employer Resource Connection, we should be seeing a higher degree of federal fund match than what has actually been reported. So I'm going to take a look at some of the accounting codes here just to make sure that everything is being coded properly. We've set up the accounting codes to allow us to get a better federal match, and we may see in the future reversal of that and see the funds shift from general fund to federal fund. But as of at present, seeing the federal match dollars, we're not at risk of overspending our general fund. We're still in good shape, and we're still making sure that everything is done properly on the accounting side. For the Home Care Commissioners, this is the stipend or per diem payments to commissioners. Many commissioners serve on multiple commissions, and I believe legislation was recently passed that would remove stipends or payments to commissioners for serving on commissioners from their qualifications for their eligibility. So we should be seeing that. And Jenny was going to follow up with commissioners to make sure that they were submitting their expenses to be reimbursed appropriately. For workforce support and development, this is still tracking a little under what we would hope. And did I see a question pop up?
Yeah. Could you explain about commissioners and per diem once more?
Yes. So at the beginning of the 21-23 biennium, a legislation was passed to increase commissioner stipend from $30 to $155. And there was a negative impact on that was not anticipated. The way that the legislation was written, it needed to be reported as ordinary income because it was classified as income rather than as reimbursement for expenses. And so they needed to adjust the way that the legislation was written so that commissioners could receive compensation for serving on the commission without risking their eligibility for services. And that was since passed, I believe, in the 23 legislative session where the language was adjusted. Jenny, can you confirm that?
I'm sorry, Brian, will you repeat what you just said to me?
Yes, the legislation regarding the commissioner's stipends being reclassified as income to reimbursement, I believe that was passed in the 23 legislative session.
I think so, but I'll need to verify that.
Okay. And once Jenny's verified that, she'll reach out with additional information. Yes, Commissioner Adams.
Are we also talking about where the state of Oregon now comes in after they approved it to get the green light from Social Security and all those? Is that what we're also talking about?
That may be. I'm not sure of the functionality of that.
Okay.
Just seeing that we've only had $36 of expenses lends me to see that there's still a barrier to individuals getting reimbursed for serving on commissions. And I want to make sure that those barriers are removed.
And there was, oops, am I muted? No.
I can hear you, Commissioner Wenzel.
Oh, okay. There were two trains of thought. The Home Care Commission was holding that you could only receive a reimbursement from one singular commission, whereas the people in the excuse me, agency payroll office and in WIN program, etc., said that as long as you were not making a claim for from multiple commissions for the same meeting that they
Correct.
were. So it is that way now. Multiple commissions, as long as you're not double dipping for the same meeting.
Right, and I also understand that if you have, for example, a home care commission meeting in the morning and then another commission meeting in the afternoon, you'd not be able to receive per diem for both. It would have to be split up.
That's fine. The world is changing for
Oh,
the better,
yes.
folks.
Y-
Nobody else may believe it, but I live on the 4th floor. I feel like throwing my window open and telling the world that it's better. Okay,
All right.
thank you.
So we've been tracking the provider parking reimbursement fund. Usually these claims are processed about a month to 2 in arrears, just as people are gathering their receipts. We budgeted $10,000 for this, so seeing this at $1,600 at this point is right on spot what we would want to see. Heidi, if you'll go to the next page. This you can see those payroll numbers. In August 23, you see the impact of that $1,500 bonus paid out to employees, as well as the December 23 reduction for the individual that had their payroll reclassified for the humanitarian aid. If I were to remove that, what we would see is a line increasing from that $190,000 in July up to about $210,000 for December 23. So this is tracking upwards at about 1.5% a month, which is exactly what we were anticipating. For services and supplies, you can see by this image that there's very little in the first month, just because those services are usually paid a month to 2 months in arrears. And we've had a little bit of a dip over October, November, December. So we've got some additional resources available to spend in our services and supplies, professional services, training dollars, and we'll be able to see that as we go forward. Next chart, we have developmental disability and mental health group. What we've seen here is we've seen a drive by our leadership team to have the temporary staff through GALT process those late pay penalty backlogs. We are seeing a little bit of a lag in this, but we should see this pick up. Spend $90,000 of our budget to date, or I'm sorry, $148,000 of our budget to date. That's a little under the 25% mark, but not much. For our employer resource connection for our ODDS and HSD consumers, this is another area where I would like to see a higher degree of our federal fund match. Again, we're tracking at about 33% a federal match, and it was determined by APD leadership that we should be eligible for, I believe, the FMAP rate, which if memory serves, we're just over 63%. For the 23-25 biennium. And so we should see a little bit of an uptick here. Some of those general fund dollars being pushed to federal funds for those matching dollars, and we'll look at the accounting on that. The total funds spent for ERC, we are under budget, so we've got a lot of room to work there. And looking at these numbers, we are seeing an increase in our PSW ERCs. This is slight increase on a month-to-month basis. Our red line is for our home care commission training. Again, an increase here on a month-to-month basis. We did have for our home care commission ERC a payment correction in October that offset those numbers from August and September that were uncharacteristically high. So we should see those numbers even out. The next graph is showing our traditional health workers training. We've only got 12.34% to date. However, we are working on some training materials and other expenses, so we should see this drive up over the next few months. the THW committee, that $1,500, if we look back at the 21-23 report, we didn't spend any of this in last month either. And a lot of that has to do with the nature of the training just not being in person as it was before. And so the likelihood that that particular training will end up getting rolled into the other training is highly likely in the future. For our enhanced and exceptional and ventilator dependent quadriplegia population, this area is our highest degree of care needs. And so the training here, we've got the $162,000 of budget available. Over the last couple of biennium, we've underspent, but it's for this particular population, it's been determined to have a higher budget available just to ensure that there's not a risk of running out of resources for these individuals. For our training stipend, we've got just under $1.1 million of available budget. We've spent $157,000 to date, and you can see the spending by budget on the next chart. Driven largely by our HCW APD and our PSWs for our developmental disability groups. Again, these invoices are usually processed about a month or so in arrears, and so seeing it slightly under the 25% is acceptable and anticipated at this point, and we should see that drive up in the next few months. Our training revenue to date, we've got $202 of training revenue received. Again, I'm not sure if there is a lot of value in recording this and reporting it, but I'll leave that up to Jenny if she wants to include it on this particular report. With that, that concludes the report for the Home Care Commission budget report for December 2023. I see we have one more question from Commissioner Adams. Yes, sir. And I'm sorry, you're still muted, sir.
Okay, I do want to say, Brian, when you put that graph up, you did an outstanding work. It made me understand more when you put the graph up, so do good work. Now, do you know if there's been more staff hired to help Jenny out?
Right now, I believe we have one vacancy that's in active recruitment. Is that correct, Jenny? I think I saw her nod.
Yes, that's for the office support specialist position with the training unit.
Yep, so we've got one position that's vacant right now. The driver on that, we're seeing a savings on that specific position of about $6,000 on a month-to-month basis. So we've got room to hire. That's been greenlit, so we should have no obstacles in hiring the only vacant position we have on the commission report or on the commission admin section.
And so how many more people is Jenny wanting to more hire? How many more people?
I believe the only other people that Jenny is looking at is related to the temporary people to resolve the backlog, and those are professional services, and we've got plenty of budget for that. So no actual full-time staff in the Home Care Commission administrative section, just cleaning up some of the backlog. So we've only got one open position and one recruitment, and I think that's all you're looking for right now, isn't it, Jenny?
Yes, that's what we're recruiting for. That's not to say that we don't need more staff in our customer relations unit. So I'm advocating for that, but we don't have those positions currently.
Okay, because I just wanted to make sure that there was a current flow of enabled consumers and employers able to get through without having to leave messages. I'm hoping.
Are you referring, George, are you referring to having, when you call Home Care Commission, someone pick up the phone and say, hello, how can we help you? And they'll connect you, or?
Correct, when they're not having to leave a message and have to wait for a reply back. I'm looking at the current, to keep things current where they're not having to sit and wait. to get an answer back.
I feel you, George, with that. I feel particularly frustrated because it's not easy for me to send off an email because it takes my fine motor dexterity is not cooperating. So when I can't reach someone by phone, and I just feel that I can't, my communication is all messed up. So
It,
I think that's so important for
it
them to
sounds
know
to me
we're
like that
alive.
yeah, it sounds to me like that communication would be a barrier to care. And what I will do is offline, outside of the meeting, I'll speak with Jenny about the available budget for possible temporary staff and opportunities to request additional staff for this upcoming biennium, the 25-27 biennium, for that specific purpose. And I can find out and provide her numbers on how much that will cost on both a month-to-month basis and on a biennial basis, so they can prepare and present that as a policy option package while we're building the budget for 25-27.
So cool. Now, Brian, I know you introduced a new staff member.
Yes.
And I'm sure that he's very competent. But I have a worry. Does that mean we won't see your face?
I'll tell you what, my goal as a person in training is to make sure that the customers, this commission is receiving the best service possible. I'm going to be with COLA going through the budget numbers every single month until he's at a point of comfort where he says, Brian, we don't need you anymore. Our plan is on the May report for COLA to be the presenter, and I'll work on helping him prepare so that the service that you receive is as good or better than the service that I've provided. I recognize the importance of the work that this commission does, and I promise to not leave you in incapable hands. If you invite me to participate in any of the meetings, I would love to join. I'll probably hang out and be a fly on the wall as Cola's presenting over the next couple presentations. So you'll still see me for a little while until you say, Brian, we don't need you anymore. And then I'll wish you well.
And I'll do everything I can to take a long time to figure everything out. So we've got an excuse to keep Brian roped in.
Oh, I like your approach. Yeah. There are numbers, and I know they have a function, but numbers with a heart in them are very unique, and I so appreciate that.
I want to
Yeah,
thank,
and that's one reason why we brought COLA on. I apologize, Commissioner Adams. I didn't make sure that your prior question was answered.
I want to thank Commissioner Winslow for her support with me on the customer flow to this commission.
Oh, you're absolutely right, George. Yes.
Well, I want to thank you, Brian, for your presentation, and we are running behind in our agenda. So I need to move us on.
All right.
But I am grateful that you have been such a good part of our commission meetings, and that you've always had answers for us. And I thank you for that.
Well, thank you so much. And with that, I express my gratitude for the entire commission for the work that you do on behalf of the most vulnerable Oregonians. It's truly remarkable labor, and you are absolutely valued to me. I turn the time back over to the commission.
Okay. Thank you. Okay. So we are down to the Mary, do you have anything for oh, Paul has his hand up.
Yes, Ruth, I'll need to step out in just a minute and be back as soon as I can. Can I go ahead and get the APD
Yes,
report?
yes.
I don't have much to say except I did check with Matt to see what he would want to share. And he wanted me to simply share that the work is continuing with the OPIM program approval. And they had a conference even this week. So the progress is being made, and more information, an update will be provided soon. I believe Matt is scheduled, from what I understand, for the next month meeting. And that'll be a good time because by then there should be some real clarification on some of the decisions and progress that's being made for this program. So that's all I have to add at this time related to the OPIM program.
Okay, thank you. Then Mary, go ahead.
Unfortunately, I was unable to attend the meeting. I had another conference in Washington, D.C., so no report this month.
Okay. And we don't have anything from the Oregon Disabilities Commission, unless, Marcia, do you have anything?
Yes, I can step in there. The
Okay.
majority of our meeting was looking at our goals from the previous year and developing goals for this year. And we will try to measure how far along we have gotten, and we've set a good basis to start our year by figuring out where we're at and where we should go. It's quite
Okay.
simple. Go ahead.
Okay. Any questions for Marcia? Okay, then let's go down to 04AD. Did they leave any written report or anything? Okay,
No, Randy just said that she would be absent this month.
okay. Then what about community advisory councils and
Okay.
coordinated care?
Okay, I'm gonna put the CACs and the CCOs together here.
Okay,
What's going on is the CCOs for Medicare and Medicaid dual eligibles. There's going to be a app on some of the CCOs. They're combining with the Medicare and Medicaid together on one app on some of the CCOs throughout the state of Oregon, where you'll only be able to go on one app instead of two separate apps to make it easier for dual eligible people. So like I said, some CCOs are doing that, some are not. So you might want to check with your CCO if you're dual eligible.
Baby balls? Huh? Baby balls?
The other thing is OHA has come up with a new plan called the Bridge Gap, and they're trying to combine it with the 1115 waiver. I'm not quite sure how that's all going to come together, but they're trying to combine both of them together.
What was that, Paul? OHA has created a what?
OHA has come up with a new program thing called the Bridge.
Paul,
Okay,
could you submit that? Could you give us you have it written out? Could you send that to Heidi so she could send it out to everyone?
I'm not Paul.
No, George.
George.
Yeah.
Yeah, I'll try to do that. Yeah. I've got one invite for the Bridge.
We found one.
And I already got the invite from the 1115 waiver committee that I was on. So I'll try to bring.
Not in the bathroom. Oh,
That's where it down.
Marcia, you need to mute. Go ahead, George.
So what I'll do is I got the invite already from the OHA Bridge, and I already was on the 1115 waiver committee. I was the guest. I wasn't in the committee, but they're trying to somehow bring those two together. And some,
Okay, but it would help us if you would send this kind of information to Heidi, and Heidi could send it out to all of us.
okay, I can do that.
And even even if you've just had a meeting and you got some new information, and just send it to Heidi, and then Heidi can send it to the commissioners.
Oh, so you want me to do it before I say it here?
If there's something that's moving real fast, yes.
Okay, sorry.
Yeah, just so that we can keep up, because you have a lot of good information, but we need to make sure that it's gotten out timely.
Okay, sorry. I'll do a better job next time.
Well, you're doing fine. You're giving us information that we would not get otherwise. So we do appreciate that you're doing this for us.
Okay, and there was another update. I think I trying to remember what that update was. But OHA is trying to do another thing. I'm trying to remember what that is. But I'll just leave that update alone until next time.
Okay.
George, if you just send it to me in writing when you think of it, I can share that with the commissioners and Jenny.
Okay.
And Ruth, we didn't get around to the renaming of the OHCC registry.
Oh, that's right.
So I know that we have a break and Justin Witham is coming at 12. But you and the commissioners can decide when you want to cover that. So
Well, we our break is at 11:45. How long is it going to take to cover it?
It won't take very long. It's just posing the question to the commissioners that we do need to rebrand our registry and just
Okay,
getting some
let's
ideas.
go ahead. Why don't you just go ahead and start presenting it then?
Oh, okay. So as you know, there is the Carina registry that is for individuals looking for a home care worker, a personal support worker, a personal care attendant, and it's supposed to be Carina is supposed to be used exclusively to match Medicaid individuals receiving Medicaid services and providers who provide those services. So that leaves our commission that is still functioning, but as providers leave our system to register for Carina, it's going to reduce the number of people who can find a provider on our system. Carina does not, at this point, does not serve individuals who are paying privately for services, whereas our commission does that. The community is able to use our our registry. So I feel hesitant to like completely shut down our registry while people in the community are using it. So we need to reach out to the community to let them know about the changes that are happening, and we're working on that planning and developing a communication plan. So in the collective bargaining agreement, not this last time, I think, but the time before, once Carina rolled out statewide, it's in the collective bargaining agreement that we rebrand our registry. So I just want to get your feedback and thoughts and any ideas you have on how we refer to the OHCC registry, knowing that Carina is the primary place where people are going for referrals, but it's still available right now for the community.
Okay, my
Questions?
first question for you, Jenny, is how is this in the original legislation that set this up? Was any of this terminology in that?
So I did consult with the Department of Justice about that, and because we help fund Carina, we just have to like make a registry available. It doesn't mean it has to be administered by the commission.
Okay, but no, my concern was on the label or the terminology used.
No, it does use the word registry, but it doesn't indicate the name of that registry. It just says a registry.
Okay, so we have free reign in that then.
I believe so.
Do we
Okay,
pay all the costs for this registry?
I'm sorry, I couldn't hear you.
Does the commission pay all the costs for this registry?
For our current registry or Karina?
No, for our current registry. Will we be
For
paying
what we
all the
rename it.
costs?
So it would still be the same functionality. It would just be changing the name of it and changing probably the link and the message on the registry.
The bulk of the registries has been paid for when it was created, and we do pay a maintenance fee. Basically, it's to the IT team to do any maintenance on it if it malfunctions, and for the licensing.
May I get a rough figure about how much that is?
Well,
And-
it's in the budget that Brian
Okay.
presented. Yeah.
All right. Why are we doing this? For convenience of people that are not eligible for Medicaid in-home services.
I could probably help with that answer.
Yeah.
Roberta, will you repeat the question? I'm having some difficulty hearing Marcia.
Sure. She said, why would we want to, no, correct me if I'm wrong, Marcia, but I think
Yeah.
you said, why would we want to support a registry that is not supporting Medicaid, consumers? Well, it is actually, at this time, it is. I mean, I know
Well, part
that in
of
the
it,
future, the
Roberta,
plan.
part of the question is why do we want to change our name, and so that something that we've had going all this time.
Well, that was agreed upon during collective bargaining between the commission and SEIU quite some time ago.
What was? That we
That's a
keep our name?
That we would rebrand.
So the official name of ours is the Registry and Referral System. We commonly call it the registry. And I think people associate that with signing on and matching and finding providers. And now they want that association to go over to Karina.
Yeah.
And
There's
not be
nothing in
split.
our statute that says the commission has to make a registry available for the community for private pay individuals, but I know that that's an important function and resource, and that the
Yeah.
community uses our registry quite a bit. And until Karina is able to provide that service to private pay individuals, I want to make sure that the community has a way to access providers, knowing though that the number of available providers will continue to reduce over time as they move over to the Karina system.
Right. Also, we have a lot of consumers that are pending Medicaid services. And that wait time can be extensive, and they have to have providers. A lot of them are coming on to the registry and paying privately before they might be in a spin down situation, before they
see.
qualify for Medicaid. They
Okay.
will learn about our registry. We have a lot of our community partners include home health agencies, hospital discharge planners over the entire state know us. And as they discharge people from the hospital and they know they need to go home with the provider, what my experience personally is, they do know of home agencies in their communities. Many of the people do not feel they can afford to pay the hourly wage for those agencies, and they feel that they are better served with an individual home care worker. The home care workers also oftentimes are motivated to work for private pay in addition to their state wages. It's been a win-win. Okay.
This is Commissioner Adams. The name that I came up with would be,
Referral.
the name that I came up with would be Health Needs Private Pay Registry as for the name. Now, what I would like to suggest to the committee and commissioners as well is if we're going to name this registry, could we also, if it's not in the legislator thing, to set the amount of dollars or pay for, like, if someone comes in and they're doing it for private pay, for them not to go over the dollar amount for the consumer that can't afford it? Is that possible?
Okay, what does that mean?
When
That
we
one?
had the home care choice program, we were able to.
We can
set a
barely hear
rate.
you, Jenny.
Oh, sorry. When we were running the home care choice program, we were able to set a rate. But that was a specific program. But anybody on the registry who wants to work for somebody privately, that's an arrangement they make between the two of them. So it's going to be dependent on what the budget is for that individual and what the person who's providing services is willing to accept, or what their rate is. So at this point, I would say no, we would not set the rate for anybody who's just finding somebody to work privately for them.
Okay, but with the name that I just set out, Health Needs Private Pay Registry, I think that would kind of bring in more people wanting to do private pay. Because health is important, there's a need there. I don't think it'd be too obvious.
So for our current registry, we wouldn't be recruiting people to serve private pay individuals, because at this point we don't have the home care choice program and we can't guarantee that this person has passed a background check or has the needed skills. But we do know that the current providers on our registry have passed a background check because they're home care workers or personal support workers who also happen to say they want to work for people privately.
So the commission is held harmless for anyone that would be on this registry that may not be qualified in any manner, training or background check or.
Well, for our registry, they cannot be on there unless they have passed a background check. So the registry was designed for providers who provide Medicaid services. So they're enrolled by the state. They're on that registry because they've passed a background check. They've done training. They've met those enrollment standards. So we wouldn't be repurposing our current registry to serve private pay individuals, but our registry is available still to those people in the community who want to hire a home care worker who says they will also work for private pay individuals.
So we'll be collecting their background check information to assure that they can be on this registry.
Well, we're not expanding the registry. So anybody who's currently on the registry as a provider has passed a background check, and they wouldn't be on the registry without having already passed all those checks for Medicaid provider enrollment.
Will we be adding additional people as they come along?
No.
Oh, so it will eventually expire itself.
Yes.
Extinguish itself.
Yes, but I
see.
did not want to take that resource away without involving the community and letting them know what's happening, and that I don't know how much the community knows about Carina and how to use it and where to go to help individuals who receive Medicaid services.
Okay.
And my hope is that Carina will eventually serve individuals who are looking to hire privately.
Okay. I understand better. Thank you.
You're welcome. So I just wanted to put that out there. We don't have to generate a name today, but I would like you to think about it. We can continue to have the discussion about it.
I would like to see us go into an executive session and sit down and really discuss the pros and cons.
Okay. Heidi, could you please arrange for that?
I second that.
Okay, is there any further discussion on this issue?
I can
Then
send out a
you-
doodle poll to people and maybe look for answers within a week and then set something
Yes.
up.
Okay, thank you.
hmm
Okay, we've got a few minutes. Justin's not here yet, is he?
No, he's not, but he should be.
Okay.
He's scheduled for 12 o'clock.
Right. So we got what, 4 or 5 minutes?
1 minute. Right, it's 11:59.
I like your idea, Jenny.
What was that idea? You're gonna have to remind me.
Having two types of registry and which ones to go to.
Commissioner McEwen, I did have a question I wanted to ask quickly about the commissioners representing us in these other committees. And I see that there's a list there on the agenda. I wasn't sure if there are other advisory committees or commissions or organizations that we could be part of. Like, I don't know, like how the community advisory councils and the coordinated care organizations were added, but are there other opportunities that commissioners would like to pursue in being part of other maybe advocacy groups or organizations? I just don't know the history. Is anybody able to offer any insight? Ruth, if you're talking, we can't hear you.
I just got kicked out again, so
Oh,
I
no.
didn't get to hear your question.
Oh, my question is, I see on the agenda all the different committees and commissions and organizations that we have representatives on from the commission. I wasn't sure if this was all inclusive, like I'm not sure how some of them were added, but are there other ways for us to be part of other advocacy groups or organizations and have representation on? You know, if anybody's interested in pursuing that at all.
You mean someone on the commission to be part of another group? Or are you talking about a
Yes.
reciprocal partner agreement?
So I don't know if, like, for instance, the community advisory councils and the coordinated care organizations, is there something in their bylaws or something where that we have a seat on there, or is it just something that we've been involved in and so we report on it? So I'm just wondering if commissioners are interested in expanding what they participate in and sit on and
Well, these are the ones that are demanded.
are there
That
others that you'd want to be part of?
yeah, we could say that, but it wouldn't be the same as we are demanded to be interactive with these groups.
Okay.
That's in the original legislation even. So, and it's also in our bylaws. So if we want to get involved in other groups, then that would be, you know, our interest in our volunteering, wanting to get better acquainted with other outside groups.
You're talking about sending one commissioner to another group as a participant and
Yes.
sharing back with us. You're not
Yes.
talking about the commission, our commission, being a partner with another one.
Right. I know that we have commissioners involved in these other areas, but I wasn't sure if you were interested or had the capacity to, for time purposes, to participate in other things that may be happening.
Jenny, on other groups that I've sat on, we have a space on the agenda for anyone who is at the meeting and knows what's going on another group if they would like to report on it.
Okay,
Could we do something like that?
I would think so. Yeah, maybe we could talk about it next time
Okay,
because Justin is here. I don't want to take his time.
okay, Justin, we are ready for you.
Awesome, thank you. And sorry, I'm a few minutes later than I meant to be, but it has been a very busy morning.
Well,
Um,
we just now are catching up on our agenda, so
Oh, well,
you're working just fine.
cool. I'm not 100% sure how to approach my legislative updates just because I'm in kind of a weird gray area right now. I don't know if anybody has been tracking it, but all of the bills that are going to be heard at the 2024 session were just released last night. So my entire morning has been spent just trying to read through them as quickly as possible. I've gotten about halfway through so far. My head hurts. But one of the main things I'm finding is that there are a lot of bills that were put forward that seem to just be placeholder bills, which, meaning that there isn't a lot of really specific content to the bills, but the bills have been introduced so that they can be used for future amendments. If any legislators have ideas about what they might want to plug in. So as an example, one of the top issues discussed in the media and in state government today is Measure 110, addiction services, substance use disorder, et cetera, et cetera. And I think I've come across 8 different bills so far that are like calling for a study on the use of controlled substances, or calling for a study on substance use disorder treatment services, or all of these like study bills. And typically when you see that on the first day of session, that doesn't mean that the legislator who introduced that bill actually wants that study to be produced. What it usually means is they told legislative council, hey, I have some ideas I'm tossing around about substance use. Can you just put a study bill in and we'll introduce an amendment later if there's time? And that's a really useful exercise in a long session where there is time for amendments. In the short session, I think unless those amendments are already being drafted, it's really unlikely that there's going to be enough time for them to be drafted, finalized, introduced, debated, and then applied to all of these placeholder bills. So the end result of all of that is that I think of all of these study bills I'm seeing, probably none of them are going anywhere. As for bills with actual substance that I have seen, of course, we do have our agency with choice bill, and I didn't even take note of the bill number on that one. I'm going to see if I can pull it up really quickly while I'm talking. There is a bill that will continue an existing tax assessment that long-term care facilities pay. And that's uncontroversial. It's a good source of revenue for the state, and it also actually benefits the long-term care facilities themselves, so they're all for it. There is, one bill I haven't come across yet that I know has been introduced is, I think last time I mentioned there's a bill to expand capacity in certain adult foster homes, adult care homes. That one is going to be an interesting conversation in the committee because I think the proponents of it have really good reasons for bringing it forward, but also it's kind of, if it passes, it will create a lot of complications for ongoing work around APD's reimbursement rates for adult foster homes and for other facilities. We have that long-term study underway to assess kind of the rates and wages that are paid to all provider types and all of their employees throughout the APD and ODDS systems. And changing the capacity for adult foster homes, kind of changing the way that adult foster homes are regulated while we're right in the middle of that, could create more problems than it solves. So we're trying to have a really careful conversation about that to make sure that any changes that take place are, narrow enough that they work for everyone's benefit. That one's a little tricky. Yeah, agency with choice, I think, is going to be the big one, but I don't have any new information about it really since the last time we talked here. We've been having a lot of internal conversations about how we're pricing that bill, like how much we expect it to cost to implement. I had an interesting conversation with the Legislative Fiscal Office this morning, where we're going through all of the nitty-gritty details of how we're pricing that. But the overarching issue is just that we are taking on a lot of the consumer employment model consumers, individuals who are receiving those services through that program, and we're transplanting them into what is more like an agency model, even though it's not technically an in-home care agency. The agency with choice, it's called that because it is an agency. So that's switching it to like an hourly reimbursement rate that is more along the lines of what we see for in-home care agencies. And therefore, it just costs a lot more money per hour to provide services through that model. And there's really no getting around that. So as we're talking about every individual thing that feeds into that, there are supervision costs for all of the workers that are going to be providing those services. There's like benefits, there's transportation, mileage reimbursement, all of the administration rates for the people who are managing those programs, all of that stuff, it's really nickels and dimes compared to the overall cost of just one, moving them into that agency model, and two, there's an aspect of the agency with choice bill that ties the wage assumption to the average wage that home care workers are receiving under the new collective bargaining agreement, which, as you all know better than I do, is significantly higher than it used to be. So all of that comes out to, it's almost certainly going to cost over $100 million per biennium to implement the agency with choice bill. And I think that leaves it up to the legislature. Like, is this an investment of public resources that we want to make at this time? Or, given what I think APD has communicated about ongoing work around like fixing some of the problems in provider time capture and some of that other administrative work, do we want to wait to see if that solves some of the problems that the agency with choice bill is intended to solve? APD is still supporting that concept as it moves forward, but I think we have also raised a lot of questions for the legislature to consider. So, Ruth, I see your hand.
Well, we're having a problem with this in that this has been done at the agency level rather than working with advocates and consumers. And we feel like this is a decision that's being made about us without us. And so there's some real concerns here.
Yeah, I hear that. I think, APD through its communications, through its policy platforms they have been trying to engage consumers more carefully. We have also been in kind of a weird situation, and I apologize that I have to be like political in how I phrase this, but frankly, this is a strong priority for the governor's office, and APD has been raising a lot of these questions that we have heard from consumers, passing those along to the governor's office, and the governor's office is still directing us to move forward in support of the concept. So, we're trying to kind of walk that fine line of helping legislators understand how significant an investment this is going to be, how we are trying to address some of the problems through other means. And also, we're then, you will see Nikisha or Jane Ellen in a policy committee saying, yes, we support this bill. So it's kind of, I don't want to say
But
it's
nothing from the advocates on it, nothing from the consumers on it.
well, I think, as far as the consumers go, there are, as part of the public process, we would encourage consumers to make their voices heard.
But
through
they're not
public-
being informed of it.
I guess the point I was trying to raise earlier is that we had tried to share that information out through the commission, through other means, and I think I'm not sure if it's a matter of maybe our communications mailing lists not having all of the correct folks, but we, outside of the meetings we've had here where there was some concerned feedback. Primarily, the concerned feedback was from SEIU members who hadn't necessarily heard all of the details of the policy that SEIU had put forward themselves. We haven't really, at least I have not personally heard from consumers on this, despite the agency's efforts to reach out. I think, I don't work for the communications wing of APD, so I can't speak to what all of their processes have been, but I know that they have been trying to get more engagement and to inform people. If you have ideas about who I can reach out to make sure that people are aware of, upcoming public hearings on the bill, of how to testify, of how to connect with legislators on this, I would be very happy to do that. But I think the political situation is that the agency is moving forward in a supportive way, and we have tried to get that additional engagement to kind of help people provide that, contrary view. So yeah, please let me know if there are folks I can reach out to with that information about testimony. We've heard it's kind of tentatively planned to be heard in the House Committee on Early Childhood and Human Services on February 12th. I think I can find the exact time of day on the 12th if my computer cooperates. While I try to pull up my calendar, Paul, I saw you had your hand raised first.
Yeah, I appreciate all your help, Lisa. I know this is a challenge, and we know that I understand that this is a political issue as well. It's interesting what Ruth was commenting, because my understanding is one of the reasons for the agency of choice was the dissatisfaction, at least in part, of some in-home consumers in wanting to see increased communication or whatever it may be. But as Ruth was commenting, and I don't want to put words back in your mouth, Ruth, feeling that the in-home consumers maybe aren't really aware of the agency with choice option being promoted and so forth. So there's kind of a interesting, it's being used as a argument for it, and yet maybe not that many know of it. But understand. Comments though, just real quick, unless you have done so already. I understand one of the greatest challenges for agency with choice going through the legislative process is the overall cost of the program in comparison to the home care worker program and maybe also the in-home care agency programs. Do you have any comments related to the overall cost and how that could be an obstacle?
Well, like I said, it's kind of up to the legislature, and we're doing our best to kind of be flexible in how we're looking at this. I already mentioned the overall kind of purpose of the program is to set up a new delivery model, and I think that does necessarily cost a lot. we've had a lot of back and forth with the bill advocates about individual line items, and I think there is going to be some aspect of the overall cost that does come down before it's kind of finally priced, just because that, you know, it's the indication we're getting from the governor's office that we I'm trying to think of how to talk about this without like giving the entire background, which would take me half an hour easily. But I think to put it simply, some of the assumptions that went into the pricing of the bill that we have already shared have been called into question, and we're, you know, being open-minded about like where we can kind of compromise on those individual line items. But like I said, it's since we're looking at I don't remember the numbers off the top of my head, and I don't want to misquote, so please just, it's somewhere in the range of like 80 to $100 million for the first 2-year period. I just think it's a very significant request to make to the legislature during a short session when they have expressed some concerns about funding large new programs. So, you know, I do think that it could potentially be a barrier in the bill passing, but we're also, you know, we do see a lot of the benefits to consumers. It opens up additional choice. It takes off a lot of burdens of like needing to decide between the entirely consumer employed model and the entirely agency-based model. But it's also, yeah, not to repeat myself, it's a large investment for the sake of adding that choice. So again, that's a policy decision that the legislature is going to make. But we'll do our best to lay out all of the benefits and, you know, potential, I don't want to say risks, but, you know, like I mentioned already, we have provider time capture phase 2A, as we're calling it, about to go live this summer. And it was our hope, while this bill was initially being discussed, that like, well, that might get at some of these issues that the union has identified, that we definitely share their concerns about those issues. And that's why that work was already underway. It's just been kind of admittedly slow to get off the ground. So yeah, these are all factors that we're going to be really sure the legislature is taking into account while it's making this decision. George, I think you were the next person to have your hand up.
Yes, I have a comment and a question. The comment I want to make is, back in your presentation earlier, mentioned about reaching out and stuff. My suggestion is to get feedback, the feedback that you are wanting. I would suggest you sending letters and what have you to the branches, the cases branches, so then it could be filtered into the case managers and to the consumers.
To local offices and to the AAAs, you mean?
Yes.
Yeah. Yeah, and you know, that's an interesting point. I'm not sure what communication between case managers and the individuals they're talking to looks like, but I do know that the case management organizations, specifically O4AD, the area agencies on sorry, I have a very loud dog right now. Anyway, I know that O4AD is strongly supportive of this concept. So, you know, the way that case managers are, as I would guess, I don't know this for sure, but I think that case managers would probably speak really, you know, in high praise of this concept, as like, because like I mentioned, it creates more choice for consumers. It does kind of expand the variety of options, and it does sidestep some of the issues that we're seeing in like retaining members of the long-term care workforce. You know, it ensures, well, it doesn't ensure, but it definitely minimizes the risk of some of the late payment issues that led to this conversation. And so that's like a huge benefit that we see in this program. And I think that is largely how case managers would be likely to talk about it is, well, you know, individual receiving services, you have had 3 home care workers that have left this workforce now. And maybe the next home care worker you get through the agency with choice model would not be as likely to, get burned out or run into like financial troubles because of late payments, those sorts of issues. So I think, with O4AD being so strongly supportive, I'd imagine that they're already talking to case managers about this. And no, I see Ruth shaking her head. Well, I guess that'll teach me to give anybody the benefit of the doubt, Ruth. But I think, thanks, George. That is good advice for how to get the word out.
Well, I know for a fact there's a branch manager down here that isn't getting hardly any emails from us. And the branch manager needs to get more information from you guys. And she's not getting it in her own branch.
I will definitely pass that along to our communications team and see if we can.
My question is,
Oh, yeah.
it was presented earlier with Brian, I think his name, about the Stippet issue. Was that passed? And if so, how far has it gone for us?
Nothing passed on that in the 2023 session. That was, again, a conversation that was being led by O4AD, that the case management entity. And I think there are just a lot of complications with federal law. I have tried to check in about this, and I wasn't able to get any information since our last meeting. But as far as I know, it's not, again, I've only read half of the bills that are being introduced this year, but I haven't seen anything about it yet. And I haven't heard that there are any bills being introduced about it this year. I know it's an ongoing problem, and it's one that I'm going to keep bringing up with APD leadership. But I think the complications with federal law just get in the way, and there's not all that much that can be done at the state level.
Well, the more there's a delay, Justin, the less chance of people wanting to join.
I understand. Yeah.
Okay.
Thank you. Thanks for continuing to bring that up, George. And please, next time I'm here, bring it up again. It helps keep me honest. It helps keep me focused on that.
Okay.
Ruth.
Well, I'm concerned when you're talking about working this through case managers. In the last 18 months, I've had 7 different case managers. When there is no stability in case managers, there's not going to be stability in presenting something to the consumer. And so I think you got a big weak link that you're working with. At the same time, this is the consumer is not being educated that this is happening and what's going on.
Yeah. I think the best I can say in response to that is that we're well aware of the case management, sort of the volatility in relationships between case managers and the folks that they're helping out on a day-to-day basis. One of the asks that APD has made for this 2024 legislative session is increased funding for case management services. That, again, we talk about not having enough people employed in this area of state work, and how that leads to burnout, it leads to high turnover, it leads to that sort of instability in the one-on-one relationships that case managers should ideally be forming. And we've asked for, off the top of my head, I think it's 59 additional positions for case management services. And that is intended to help. There's kind of this gap in between how our workload model defines the number of case managers that we need and how that actually works on the ground, because the workload model doesn't fully factor in the folks who aren't yet receiving services, who are kind of case management only. And we have made an ask to try and pick up that gap, which is, I think it comes out to about 59 or 60 case managers. So the hope is that if we get that funding, we can improve some of the retention that we see in the case management workforce, improve like the length of relationships that people have with their case managers, so there's less turnover. And that would in turn help, improve that sort of level of trust and communication that exists between a case manager and an individual. That is unfortunately a long-term solution. Once we get the money, we have to hire those positions. Those relationships have to be built, but that is the goal of increasing that funding. But again, I will take back all of this feedback and mention it to our communications
But if you
folks
don't
and-
train these people, then, and we're going to wind up with another boondoggle like we had when we created the brokerages.
I might not have enough history in how the brokerages creation went, but obviously
it didn't
I think
go very good.
training is definitely a part of the funding that we're asking for. That I think the actual act of training case managers probably falls on the local branches and on the local AAAs more than on the state. But I think there are expectations definitely written into rules and statutes that training needs to take place and that it needs to hit certain benchmarks so that people are able to take on the workload that they're tasked with. I don't know. Unfortunately, I don't know any of those details. I'm sorry. Marcia, I see your hand has been up for a while. Oh, and you're muted. I don't know if you're talking. Or I saw your hand come down. Maybe you don't want to talk anymore. That's fine too.
I didn't unmute myself. Here. First, as a consumer myself, I've never heard zip about agency with choice. And I read all of my communications and nowhere. So if I don't know it, I would assume that there are a great many others that don't.
Yeah, particularly given how engaged you are, Marcia. I know that you track all of these issues closely. So I'll add this to my list of things that I'm taking back.
Yeah.
Anyway, sorry if you have more.
Yeah. I have a great concern. Well, the Oregon Home Care Commission has not been given a chance for rebuttal. I mean, they had short snippets, but there was not an ongoing dialogue that I'm aware of with these and the points and a chance to for the Oregon Home Care Commission to plan to remediate anything. It's just like, in my opinion, they just got a tsunami on top of them, and now it's almost like too late. It did not come along in a normal progression that, in my opinion, where two opinions would discuss. They're not, they don't represent different football teams or what. They're for the same cause. And why didn't they move along in tandem to see if there should be an agency with choice, or because Oregon is so unique in its constitutional founding for the Oregon Home Care Commission that money should be put in to remediate, adjust, and point of information for you. What is it? Our PTC DCI was actually selected by SEIU. And it is now looks in reflection on documents about agency with choice that it's the problem child of Oregon Home Commission, but it got sort of got placed upon it. And so Oregon Home Commission, it was not their child to change and go ahead and do whatever they needed to do with it. They just, there it was.
No, I can maybe respond with a couple of points. One is that, oh, hi Rachel, I didn't realize you were here. So I was just going to say, one of the points that we've raised with SEIU throughout this conversation over the course of the last couple of years is that, you know, the Home Care Commission, well, I'll say this two different ways. One is that the Home Care Commission is, you know, that a constitutional entity, like you mentioned, and we really value the role that the voters brought in way back in, I think, 99, that the Home Care Commission should stand as the, you know, bargaining partner for the home care workforce, the sort of designated overseer of that workforce, and that if we are implementing an agency with choice to sort of stand alongside the Home Care Commission, we don't want a situation where the establishment of the agency with choice provider in any way impacts the Home Care Commission's capacity to continue overseeing the home care worker workforce. That, you know, to go back to how we're pricing the bill, our pricing does not involve any reduction in funding for home care workers, for the Home Care Commission. We're trying very hard to protect all of the work that goes on over here. Another point that we've reiterated is kind of, it's a convenient shorthand to say that the consumer employment model is the Home Care Commission model, but APD has been really careful to take on a lot of the heat that is sometimes unintentionally thrown your way as the commission, where people will say, well, the Home Care Commission model just isn't working. People are getting late payments. People are having all of these problems. The APD policy team is always careful to say that is not the Home Care Commission's fault. That is because we're working on antiquated systems. We're working with a lot of this very complicated and detail-oriented work is being left with APD local office, you know, front desk staff who are trying to deal with all of the other stuff that they have on their plates and trying to, you know, manage their families and trying to, you know, take vacations and all of these things that have led to unintentional problems that have had these really disastrous impacts for home care workers. That's APD's fault. That is not the Home Care Commission's fault. So we've, you know, just to the extent that it might be comforting, APD really has the Home Care Commission's back as we're having these conversations. And, you know, again, as far as communication out to consumers and to the commission goes, I apologize for any part that I had in like detriments there, but I think I think there have been a lot of efforts made, and it's been a very complicated conversation with a lot of different folks at the table. And so I think there have unfortunately been a lot of gaps in that communication. Apologies again.
Now, the Home Care Commission serves the entire population of Medicaid eligible persons. I've done some reading about agency with choice in, let's put it, other parts of the universe. And well, the wind took half of my apartment down. No, sorry. In reading about agency with choice in other places, they employed an algorithm to see if you were eligible for in-home care. That makes me fearful.
Well, I think eligibility, agency with choice under the bill that's being considered in Oregon does not take on eligibility as part of their purview. That will remain in APD and their eligibility team.
Yeah.
So that's, we're not handing that aspect over to whoever the provider wants.
I wasn't referring to that, but remember that part still deals with the cobalt dinosaur. All right.
Yeah.
So they're not going to be able to get over that either. We both saw Home Care Commission and Agency of Choice have a piece of the cobalt dinosaur. But my point was a medical algorithm. And they could skim off the top, a deeper top, the more medical need you have, and the higher the cost. And I have read in other readings about agency with choice, not in Oregon, but that this was done and it lowered the cost of agency with choice. It would skew the data if this was done and compared with Oregon Home Care Commission as it is now, that does not algorithm you deeply for your disability.
Marcia, if you have anything, any like written articles you've read that you want to send my way, I would be happy to pass those along to folks and talk them through with our, with the folks who kind of wrote this policy to see if those are concerns that we're able to address early on. Definitely, I think our goal would be in providing equivalent services and just trying to improve the issues that we're seeing both from the ground up in agency with choice and through the existing consumer employment model.
It might not be in the first phase, but to make when it came later to compare the cost of apples and oranges, it might be employed to bring the cost of one under the other. It makes me feel fragile instead of stable. I might be skimmed off, but I'm still thoroughly capable of a vital life, and my brain is still working relatively well.
Well, I definitely, I mean, I'm not sure I can fully reassure you without knowing the details of everything you read, but I do think, the goal of this program would be to increase our capacity to serve, to increase the workforce, to give more people access to services. We hear, especially in rural areas, I'm sure you hear it more than I do, there are folks who just can't get connected with someone to come provide in-home care services. And I think SEIU sees this, and APD sees this as a potential path to increase the number of providers in any given area to try and increase the access to services and through some of the improved retention to improve the length that people are staying in the workforce and providing the services. So I definitely don't think, I mean, we will take every precaution to build a program that does not result in people losing services. That is the opposite of the intent with this bill. Paul, I see your hand is up, and I do have to run. I have another meeting in 2 minutes that I have to get back to reading bills, basically.
Yeah, thank you, Justin. So is the current version of the bill, to your knowledge, does it include long-term community nursing or not? My understanding is it did not.
I think not, but I have not looked at the brand new language that was just released to even determine whether it's had any changes. The last version I saw did not, but don't quote me on that. I'll try to follow up. I know Jenny is among the people who will be reviewing that bill language alongside me. So she and I will try to get communication out to this group about what exactly it contains. Is that okay that I volunteered you for that, Jenny?
Yes, thank you.
Okay, great.
What is the bill number?
You know, that is a great question. Just 1 second, I'll pull that up for you.
Okay.
I'll drop a link in here as well. I should know that off the top of my head already. Sorry, it's the worst day I could possibly imagine to have the number of computer problems I've been having. I'm just staring at a screen while it tries to load. Okay, the House bill is 4129, and I will post that in the chat here in the form of a link to OLIS. Oh, and I guess that's a link to the overview page. If anybody wants to read the actual bill language, it is the second link that I'm posting.
Yeah.
And yeah, you know, I welcome your ideas about how to improve our communication about this. I would love to be able to send out the broadest possible communication to say, hey, if you're a consumer of these services, you might want to weigh in at this public hearing that's taking place on February 12th. My hope would be that kind of input from consumers wouldn't be based on, I guess, if people have questions about the bill that they would like to address before they go talk to the legislature about it, my door is open for that. I think other folks in this meeting who work at DHS would probably also be happy to try and spread information. And I know I saw Rachel was here. I'm not sure if other folks from SEIU are here, but they have a lot of information about how they're envisioning this bill as well that I'm sure they would be happy to share out. So I'm going to drop my email address in the chat here. I think most of you probably have it, but please feel free to reach out. I will do my best to respond during what has been a very hectic couple of days, but I'm hoping to get all caught up here in the next couple of days and be able to answer any questions folks have. With that, I do have to run. I'm really sorry. I know this is a challenging conversation, and I wish I could spend more time on it, but please reach out if you have more questions.
Thank you so much, Justin.
Thanks, everybody.
Okay, this is the end of our agenda. Is there anything else anybody needs to say before we close?
Ruth, I'm going to send everybody the PDF document of the bill and also the link to the bill if people want to read it.
Please do. We would appreciate that greatly.
And Bruce,
Yes.
I'd like to stick in a reminder about the Disability Rights Oregon meeting from 2 to 4 this afternoon, specifically addressing agency with choice. And Heidi was going to send out the link and the article to everyone.
I will do that after this meeting, Ruth.
Okay,
Thank you. Thank you.
thank you. And George, you had something?
Yes, would like to remind the commissioners that if they want to attend, there is a DSAC get together on February 27th. I believe it's 2 to 4. You can get with Joseph with that. Joseph is the one that's being the narrator to that, February 27th.
Okay.
He's bringing all the district managers and everything.
Yes, okay. We can send that information to Heidi and she can send it out if it needs to be sent out.
It's already being sent out to her as we speak.
Okay.
I will
It's-
send the information for both the DSEC meeting and the Disability Rights Oregon meeting out to commissioners and Jenny right after this meeting.
Okay. Thank you.
Mhm.
Okay. Anything else? I appreciate your just sticking with it, and I know we've gone over time, but I think it's something that is important for us to learn more about. And thank you for hanging in there with us. And if there's nothing further, then I will declare this as adjournment.
And I will miss you all until the next meeting.
Thank you. Okay,
Thank
we're
you,
done.
everyone.
Bye-bye.
Bye-bye.
Bye.